Governor Evers is getting some criticism after he vetoed legislation that would have expanded opportunities for qualified nurses to start their own practices. Our political reporter Dariel Fair spoke with advocates on both sides of the issue, and she's got you covered on how one group argues the proposal needed additional safeguards, and the other says it would have addressed the state's health care shortages.
On Thursday, Governor Tony Evers vetoed a proposal that would have granted nurse practitioners, clinical nurse specialists, and nurses with other advanced degrees the authority to practice independently. Advanced practice registered nurses are nurses who have met advanced educational and clinical practice requirements and often provide services in community settings. Advocates in support of the legislation said they were disappointed by Evers' actions, arguing the proposal was set to increase patient access to health care by allowing the state's more than 8,000 APRNs to deliver care through their own practices.
It's a barrier, I would say, to really wanting to be able to provide that care to their patients, especially where we're seeing these nurses opening their practices. It's in our rural areas where there's quite a physician shortage. Also in our communities where there are a lot of high health disparities.
I spoke with Gina Champion, Executive Director of the Wisconsin Nurses Association. She says the bill lists specific criteria that would ensure the best quality of care for patients. Dr. Don Lee, a physician and president of the Wisconsin Medical Society, raised concerns that the bill lacked the minimum patient protections needed to allow APRNs to have independent practices.
We do think that there is a path forward for independent nursing practice, but this bill fell short.
Danique Champion says when the legislative session begins next year, her organization plans to continue advocating and working to address some of those provisions causing concern to get this proposal over the finish line. Reporting in Madison, Dariel Fair, 27 News.